Thank you, Dr. Shruti, for such a nice and a very simple way of explaining the concepts of homeopathy. I'm pretty sure people who are here would understand it. And this is the root basic uh, philosophy on which the homeopathic science is based, and that's the reason it's almost now 260 plus years that this philosophy is working, and it's spreading and helping people. So, on this laws, right? So, the idea is that when you understand this concept, this philosophy, now how do we apply it? How do we uh, take use of this concept? So, with regard to patient's point of view, right? Many times, as Dr. Shruti said, that many times patients are in a situation where their concern is their own complaints, whether it is headache, sore throat, body pain, or stomach pain, or blood pressure, or diabetes, or anything else. So, for someone to, for a homeopath, it's very important to understand who this person is, who this individual is, how he is suffering, what is his suffering. That what Dr. Shruti says is individual. Who this individual is suffering and how it is he is suffering. For that, there is a little process or a methodology which we follow as a doctors, and that is called as enquiry. Right? We go into the life process of that individual, try to see different aspects of his life. It may be his emotional side, it may be his psychological side, it may be his physical aspects. So today my talk would be what are the points or the areas a homeopath dives into, and as a point of view a patient, what he has to prepare himself when he is coming. Because in any way, it's a team effort. How much a patient gives and how much a doctor gives, if both of them together work, the success is definitely there. And the entire intention of the physician who is there is to help his patient and see the smile of healing. That is the main concern for which he is sitting there. And he expects from a patient that if he gives this information, it makes his work easy and also helps patient to understand himself better. So at the other song homeopathic clinic, we follow a little small protocol that before a patient comes to in, we give a small form we call as homeopathic case record form. Now this form is around 25 to 30 pages, and many patients get little hesitant. अरे इतना बड़ा पेज कैसे करेंगे करना है? हाँ 30 pages, I understand. So भरे कि नहीं भरे, and many of the people withdraw themselves. But actually I would tell you, even if you when you go to this entire process of this form, it's a dive into yourself, into your journey till now, what you have gone, right? It's a saying that nothing comes suddenly to your body. There's always a calling, and once we ignore that calling, we land up with physical symptoms. So this form also dives into different aspects about your life, about your childhood, about your fears, about your likes, dislikes, your aversions, your stressful situations you had in your life. Many time it brings your old memories into your present, and you get aware, oh yes, this was the time I had a very tough time in my life. It was a struggle, and I really relate to that it was so difficult. Until unless these were not there in my life, I wouldn't have gone through. So there are many aspects in this form if you just dive and make a note of it. So this helps you to sensitize before you come to a homeopath. Many times you are unable to fill it, that is okay. Even if you have a thorough read through it and make up points which are very important to you or relevant to you, that makes lot of sense for a homeopath to help. The most important aspect is the complaint on which you come, right? Some, like how Dr. Shruti mentioned about my headache is a concern, right? So when you are presenting your complaints about your headache or a sore throat or a abdominal pain, what a homeopath is looking for, right? What is he trying to understand your individual problem, right? So there are certain things as a patient you can make a note of it. For example, the cause. It's very important if he understand what is the cause, whether it is a physical cause or whether it is an emotional cause or a mental cause, right? Very simple. These days monsoon is there, everyone is falling sick, right? The other day, and you ask, कैसे हुआ? नहीं, बुखार आ गया, बुखार की दवा दो. Hands are tied for a homeopath to prescribe just on a fever, right? So he goes on inquiring. 2 दिन पहले क्या हुआ था? What happened 2 days ago? Remember? हाँ हाँ, in the evening we had gone for a party and I had a cold drink and then followed by an ice cream and it was raining outside. We also got wet and the next day morning the body started paining and little shivers and I started having fever. This is good information, right? It gives us a insight that what could be the probable group of remedies you may require. So next he asks, where is the pain? What's happening? Is it the joints paining? Is it the headache pain? So location, where, becomes very important. The more the vague, more difficulty. More specific, more easier for a homeopath. Type of pain, right? Pain hota hai doctor. Pain is pain. I have pain. You have to understand I have pain, right? But there are various kinds of pain. Burning pain, stitching pain, sore pain. किसी ने मुझे मारा है वैसा pain, and so and so and so. If you pay little attention, you will be able to describe that pain appropriately. Then, what makes things worse and better? My colleague Dr. Devang would be telling about details about it, but there are many modalities which makes your complaint worse and better, particularly when you are sick. Whether cold, hot, lying down, sitting, walking, sometimes you have to observe, make it do and observe those points. Then the most important point, what has been the change in you during your sickness? How are you reacting to? Doctor, when I get sick, I don't want anyone near me. I just want to be in my room. Dare I come, someone comes into my room. I get so wild. This is your state. After that, no one will tell me that I am such an angry person because I am such a jolly. But when I am sick, this is like no one is around me. This is the altered state. This is a thing which is very important. This is who you are. How are you affected with the complaints? Many people say that this is affecting my work, this is affecting my life, this is affecting my relationship. I am troubled by this. These are important piece of information for a homeopath. The other area which homeopath asks is about your eating habits, your addictions, your appetite, right? What you like, what you like. The casual answer is सब खाता हूँ मैं. I like everything. What is something you specifically like? So homeopathy is more concerned with something which you can't resist. Doctor, even if I have had full lunch, if someone says about sweets, I'll have 2 cups of sweets. This is something important. In other terms, I have to say what is dis-ease, something that makes you unease, is important for us, whether it with regard to the physical complaint, whether it is with regard to your mood state. Aversion, something you don't like. Doctor, I can't touch milk. Even the smell of milk is little problem for me. I get nausea, I get vomiting. Sometimes I have also seen it makes my stomach upset, I get vomiting. This is important for us. Thirst, normal पानी लगता है, 7-8 ग्लास पी लेता हूँ. This doesn't work. How much you are drinking, what sort of water you are drinking. You want cold water, warm water, it's help us. Same goes with your urine and stool complaints. Perspiration, sweating. Nowadays, everyone is AC. So when we inquire, when we are in the people who come from the metropolitan cities, when we ask about their sweating, I go in cab, I go to the office, I hardly sweat. Mostly in gym I sweat, but there is also AC. But observe yourself. Observe the time when you are not in AC, when you are with yourself, when you are in normal wear, where you sweat, how much you sweat, does it have odor? This is a natural discharge you get of a body. These are important clues for us. How do you sleep? What's the position in sleep? How much? What are you sensitive to? For example, I'm very sensitive to AC. I can't bear it. Right? My colleague wants full AC, full draft on myself. Unless I get start sweating. This is important. This shows your sensitivity to the heat and cold. Then comes a very important part is the past history and family history. Many people are saying कि मुझे अभी कंप्लेंट है, मेरे पास का क्या करेंगे? What is? But this information helps us to understand your tendencies and disposition. You will see that many people are not well after a certain disease. For example, they had a severe bad typhoid or malaria. Nowadays, very recently, you would be hearing people not well after COVID. They had a very bad COVID and they're starting getting weakness, acidity. Many people are in depression post COVID cases. And after that, it's almost 3 years. People come to us nowadays of anxiety and depression. They say, since the COVID episode happened to us, we have not got out of this. This helps us. Then a homeopath inquires what sort of depression it is, what sort of weakness it is, what makes it better or worse. So basically, it gives us the tendency and disposition. How does family history give us important? It gives you the soil, it gives you the background. You will see patients speaking that हमारे घर में ना सबको blood pressure है, diabetes है, मेरे दादा को भी था, पापा को भी था, uncle को भी है, नानी को भी है. What does it gives? It gives that if you take care of yourself, this can be postponed or not, otherwise you are on the line of it if you have not got it. So homeopath can help to reduce this tendency and disposition. Nature. This is an area where homeopath inquires a little bit more about it. When you ask about how is your nature, he says, मेरा अच्छा ही है, सब अच्छा ही बोलते हैं मुझे. I am good. Nature में और क्या बोलना है? So let me explain. What is important for a homeopath to know about your nature? What are you sensitive? What are the things that affect you? How was your reaction or experience during a situation which was very stressful? For example, office work is there and a boss is putting pressure, a deadline is there. How are you reacting? Doctor, react कैसे करना? I get wild. When I come home, I'm just wild. Are you wild at office? No, boss के सामने कैसे, right? But my subordinates have a very bad time when they come to know that I am in stress, right? This is information. So how do you react? What do you feel? What is your experience? This helps us. Any situation that was very tough for you to pass through becomes a very important part to narrate it. Fears and anxieties, right? It can be very silly fears, it can be very silly anxieties, right? It defines who you are as an individual, right? People say the doctor, आप हंसना नहीं है, मुझे वो थोड़ा चींटी से बहुत मतलब I don't like it. Even the cockroach coming here and I feel disgusted, yuck. Helps us, right? So it can be anything. It can be water, heights, close spaces, meeting new people. Doctor, I have been into my profession since almost 10 years. I have been spoken to so many people, but till now also, the moment I go on the stage, before that, I am just like, I feel I'll get blank. But the moment I go, no one comes to know. But behind, I am nervous. I don't know how will I do it, what will happen to me. This is, but how do you do? I have a bar of chocolate, doctor. I just put it, have it, munch it, relax. Then I go and have it. So, anxieties and fears, very, very important. Now, the important is dreams क्यों पूछते हो? उसका क्या करना है? Right? Dreams also play an important role. It gives you the idea about who you are in the subconscious level, right? In a broader, larger context, if I have to say, what is dream, right? The moment you wake up, then you understand it is a dream. Before that, do you remember are you in a dream? No. It's an altered reality for you where you are experiencing a dream. And that is real for you at that time. So it is also a situation to whom which you are experiencing and reacting. The moment you are out, oh, dream tha. For example, a person who is having someone who is running behind you and he is scared, he wakes up with a shriek. Right? For him, it is real that there is someone who is behind you. But the moment he comes, awakes, he knows it is a dream. So dream is also a situation for you to experience it, and that becomes important. So when homeopaths ask what is a dream and how do you experience, what is the feeling, it's very important. It's a situation you are living in. So, and there are many other areas. So these are very important areas which I have pondered upon, and if you make a note, this will really, really help to give a very precise and a very important information about you as a person. And A homeopath will take into consideration all these points which are very important to make, in a way, a symptom conglomeration, and he'll find out a suitable remedy which is in our mathematica, what Dr. Shruti was mentioning about provings, and prescribe that. And that is the many times it's a very difficult task for a homeopath to find out a remedy. Sometimes first or second sittings may not yield the exact medicine. He may come close to it, so he may need one or two sittings to understand you completely and prescribe an appropriate remedy. So now once a person has been prescribed a remedy and he has given the dose, right? What is an expected from a patient to share about his detail during a follow-up, or what a homeopath looks in a follow-up, right? So I'll be also sharing a little bit about when you go through this process, right? It takes around 45 to 60 minutes generally, but if homeopath goes little more detail and there are a lot of areas which are very sensitive, it might take the first consultation around 90 minutes or say around 100 minutes. I can tell you, in my patients' experience who have gone through this process, right? Most of the time, when they have not dived into their journey, for them, the experience sometimes will be mixed. They are with mixed emotions. They are sad, they are anxious, they are angry. For few people, they are like a revelation of their self. Oh my God, this is also me, right? From where does all this information came? So this, I would say, the first homeopathic consultation is a very dynamic process. It's a journey both the homeopath and a patient takes. And it gives a lot of insight both to homeopath and a patient. Now, when he comes for the follow up, definitely he has a lot of expectations. He feels that he should get better, and that's odd wall we intend also. So, what a homeopath looks in a follow up, right? Basically, very simple things. He looks at the 4 to 5 important points what he has come with. What is the chief complaint? What is the complaint which he has brought him to the patient? How is he better or not? Right? Many times patient, I have heard patient, I am not better doctor. इतना 1 1.5 घंटा लिया आपने, right? मैंने सोचा सब कुछ ठीक हो जाएगा एक डोज गोली से. Nothing happened. What was the things? I had severe stomach pain, doctor, and every day I get a stomach pain. And homeopath sits and asks, tell me a little about your stomach pain. How are you? So doctor, I now in this last 15 days, 4 to 5 times I got the stomach pain, severe. Acha, how was it previously? Doctor, previously I used to get every day. How is it now? It is now in once in 3 to 4 days. What is the intensity of it? Doctor, now I can eat, that the pain is not so much. And the duration, how much is there now? It is for 2 to 3 hours. So for us, when you're giving a follow-up also, it's not just the pain है पर कितना है, पहले से आज कितना है. Why it is important? Because our next plan of the remedy and the dose depends upon your piece of information, that how you have reacted to a dose. So in 3 terms, what is the change in the intensity, duration and progress of your complaints? How are you? And on that basis, the next prescription will be done. So when you're going to a homeopath, just telling your complaint, look for intensity, frequency and duration. How are you? Then he will also help ask about your other complaints, mind and mood state. How is it? Your sleep, your dreams, any new complaints you had or any new investigations you did. This gives you a little bit holistic view towards your health. Many times during the follow-up, maybe 1 2 3 follow-ups you have been following with the homeopath, there are times comes when you find out the patient has not moved much in the progress which he should, right? At that time, what a homeopath should do, or what the patient can share with the doctor. Here within the other song, what we do is we periodically, when we find in our assessment the patients have not moved forward in their progress as expected, we sit with them, we take a retake, we go through the entire process of case consultation once again and try to see where things have not worked, whether it's with regard to patient or with regard to the doctor. So what we called is as a retake or a review we take. The other thing is my colleagues are there. Dr. Devang is there, Dr. Shruti, Dr. Manish, Dr. Pratik, and Dr. Meghna. Many are there. We refer each other. We take an opinion from them to get their perspective in cases where if they are not, we are not seeing a progress there. So this is the benefit of being working together as an organization where we take each other's help and try to give the best to the patient. There are many questions asked to us as the doctor. I didn't follow up because I was feeling much better. आपने दवा दिया एक दो dose and I'm better, so I stopped. Now this is a good thing. We are happy to hear that when patient stops the medicine. But sometimes as a homeopath, let the homeopath assess you and see in which areas you are better, what areas you need to work on. Because when you took your entire history, it was not only the chief complaint that was concerned for the homeopath. There were many other areas which were of concern on which he has prescribed the dose. So just the chief complaint getting better and you stopping the medicine may not yield that much benefit. So be with the homeopath for some time, let him assess how you are going, and then take a combined call, informed call. Now it is a good time to stop the medicine. It is nothing happy for a homeopath to listen this that he is discarding the patient and he is much better. Now the second question comes is, will I get this again, or I'll be free of this disease forever? The question is yes, you will be, but at the same time, what are you doing for your health? Right? It's very important. What changes have you done in your lifestyle so that this problem should not occur again? Right? Those issues, those causes which were causing problem to you previously, are you again going back on the same track? If you're going, then definitely it will come back. So now it is in the hand of patient that they should take care of themselves, make modified changes in their lifestyle, start working on their health, changes in their diet, sleep, and the way they approach life. Little philosophy is very important to maintain a good state of health, or you can say the apparent health, right? So that they can do their duties, to do their work better. So, my friends, this is about what I had to share today about when you are going towards homeopath. You can do little preparation that will really help to build the team with your homeopath so that he can really help you in your conditions. And when you are coming with a follow up, if you are prepared for your follow up, you can help to see your progress in a much better way, right? So thank you. And I have my colleague Dr. Devang who would be sharing about giving insights about what you would be, how would you approach a homeopath when you are in trouble, severe troubles uh, with any acutes. So I invite Dr. Devang, please. Thank you so much.